Here with us today is an ICU intensivist who is willing to share the valuable information about COVID-19. Thank you, Doc, for agreeing to partner with BNA Northeastern in educating us about this novel coronavirus.
Hello, my name is Dr. Enrique Ortiz-diaz, and I'm a pulmonary and critical care doctor working in Houston, Texas. The Filipino Nurses Association of America, Texas chapter, asked me to provide a information capsule regarding the current pandemic with coronavirus 2019 or COVID. This virus accounts for 25 million cases across the globe, with over 6 million cases in the US only. In terms of deaths, represents 850,000 cases, with 183,000 and increasing every day here in the US. Unfortunately, this virus is a large single-stranded RNA virus that spreads very quickly. It spreads usually through transmission of droplet through close personal contact with infected patients, whether they know it or not. And especially the viral spread peak happens about 2 to 3 days before a patient knows or feels the symptoms of this infection, which are, fortunately, 80% of patients will have only mild symptoms that are relatively common to common colds, such as fever, fatigue, myalgias, dry cough, rhinorrhea, and also the well-known lack of smell and lack of taste happens in about 3% of cases. For about 20% of cases, the infection is more severe and sometimes requires hospitalization. The common symptom that prompts hospitalization is shortness of breath, and about 75% of patients who present with shortness of breath to the hospital, they have radiologic evidence of pneumonia, whether on x-ray or more sensitive if they use a CAT scan of the chest without contrast. 15% of cases present with ARDS, which stands for acute respiratory distress syndrome, which can be commonly understood as a severe pneumonia, in this case of COVID. About 20% of cases, a patient has acute liver injury, and that's defined by abnormalities in liver-related labs such as ALT, AST, and elevated bilirubin. About 10% also presents with increased cardiac biomarkers, which also suggests that there's a component of myocarditis in this infection. And also 10 to 25% there is a abnormality, whether in bleeding parameters or coagulation, which is the ability to form clots, and that creates a milieu for thrombotic or clotting complications, such as clots forming in abnormal places where its presence is undesirable, such as in the brain, creating strokes, or in the heart, creating heart attacks or acute coronary syndromes, or elsewhere creating a lack of circulation or perfusion or blood flow to the target organ. The treatment is largely supportive, and what that means is that there is no specific therapy targeting the virus as of yet. Mainly, we rely on keeping patients, especially in the intensive care unit, alive and supporting their vital functions, and trying to stave off complications that in the intensive care unit are acquired, such as infection, clotting disorders, muscular weakness, and also delirium, which in other circles is called brain failure or brain injury. Uh, Treatments that are in the common newspapers and also scientific publications are plasma, which its effect seemed promising at the beginning, but uh, its effect, it seems to uh, be within the early presentations, and its effect on patients, it's not uh, huge in terms of turning them around and making them healthy again. There's a drug that it's called remdesivir, which is an antiviral originally designed for the Ebola virus several years ago. That was a threat from the East Coast in Africa, and it has been extrapolated to a COVID use. The evidence that we have right now for remdesivir in moderate to severe patients with COVID who are hospitalized is that the time that they're gonna be sick seems to be less when the drug is prescribed and there are no other side effects um, from this drug showing up in the patients. The drug that also has been shown to improve the probability of dying from the disease is dexamethasone. And this dexamethasone is a very powerful steroid, which basically decreases the among its hundreds of effects all throughout the body. It decreases the amount of inflammation and tones down the amount of inflammation in the body, and also protects the vascular lining of all the organs, among many other effects. This is not specific to COVID. The effects of steroids in other life-threatening diseases have been well documented as well. In terms of prevention in the community, what we are doing right now is everywhere you go outside your house, just wear a mask. I also carry a bottle of hand sanitizer. And basically I mind where I put my hands, and also I mind because of the mask, it kind of like reminds you not to scratch your nose, not to touch your eyes. Those are the ports of entry where COVID enters your respiratory epithelium or your respiratory lining. Um, and all if you have family members who are sick with the disease, as I was, basically confining them to a room, and it's safe, hopefully, and hopefully in your houses and your residencies you have space to accommodate a, a, a a patient, and and not getting yourself sick again. In my house, nobody got sick, thank God, because they quarantined me for 10 days, which is what the CDC recommends. It used to be 14, now it's 10. Nobody got sick, and we just used nothing special, just masks and a hand sanitizer, and when I was out of the quarantine, then we cleaned all the room and the surfaces, changed the sheets, and all of that. As of thank God, I was part of the great majority who have a a mild disease, but I know personally persons that they've had a severe disease and they're at risk of death. And as a physician, even before COVID, I wanted to be helpful, and I found my calling in intensive care medicine, where my attention seemed to focus more, and the type of care that we deliver in the intensive care unit just it makes me very passionate about practicing the best medicine that I can for these very difficult situations. And also, when human medicine and human intensive care fails, providing the transition for a good death and helping the family members understand, and not, because it's very easy to, for that amount of time that you have with family members, with those patients, to be easily traumatized if you lack the tact and the training to communicate with this patient. So I wanted to be useful in these situations, and also reminding ourselves that even though that we are healthcare professionals, that we are not invincible. And we get sick, we get hungry, we need to sleep, we get sad, and I want to encourage everyone that outside of work, try to maintain a healthy lifestyle, eating well, eating fruits and vegetables, and trying to stave off a carbohydrate rich foods and fatty foods. Not always, because sometimes it's very enjoyable to splurge in terms of a diet habits, but not make it a habit in terms of those kinds of food. Exercise, relying on religion or meditation or mindfulness, or all three together, is very helpful in terms of bringing balance and peace to those of us who work in potentially very chaotic healthcare environments, and also avoiding abusing substances such as alcohol, very common and prevalent in our situation. If you are worried and tired and anxious regarding your day, it's not good to abuse these substances, because physiologically and psychologically and physically, you're gonna be affected by them in terms of your performance, and your health is going to suffer in the short term and the long term. So just I wanted for everyone to be reminded of that. Okay. So thank you for this opportunity from the Filipino Nurses Association of America.